And can I thank all members for their contributions. They were in marked difference, it has to be said, to some of the contributions that were made that were made in the Dáil. I was congratulating Deputy Bacik on entering the Dáil, but was suggesting to her that she was going to see some different styles of debate when she was in the Dáil versus in the Seanad. So can I thank everybody for I think what's been a really useful debate, including much criticism, which I've listened carefully to and we must take on board. Ciarán, I had a closing speech, but what I prefer to do, I've taken a lot of notes, is actually just try and address the various themes that were raised, if I may. The first was around solidarity. We all want solidarity, and in fact, when I was talking to Dr. Mike Ryan from the WHO last year, he said Ireland is distinguished internationally by the level of solidarity, both political solidarity and social solidarity, that we have shown. And he said that is one of the reasons why you're going to come out of this with one of the lowest mortality rates and one of the low case rates. So it's critical that we have solidarity. Now, I've been talking to a lot of people who are unvaccinated about these proposals. And what they're saying to me is, if you can open up and get tens of thousands of men and women back to work tomorrow, and all you're saying is, I've got to wait a few weeks till I get fully vaccinated. I can still go for dinner, I can still go for a drink, but I'll drink in the beer garden. And if that means that tens of thousands of people can get back to work, including many of their friends, they said, go for it, and do it now. Get them back to work. They've been out of work for a year and a half. Get them back to work. All you're asking me to do is drink in the beer garden? No problem. That is solidarity. That's solidarity. That's what solidarity means. It means taking a hit yourself for the greater good, for other people. Now, some people in this House, and indeed in the Dáil, are suggesting that what solidarity means is people saying, well, if I can't have something, nobody should have something. Nobody should be allowed to have it if I can't have it. That's not what solidarity is. And I haven't met any unvaccinated person who has said that, because it's not how people outside of this bubble think. People outside of this bubble think we are going great. We're faced with a massive wave of Delta. This has been a horrible experience for our country. But if we can get tens of thousands of men and women back to work, let's get them back to work. And all you're telling me is I have to wait till I get Janssen in the pharmacy or I get Pfizer in the vaccine centre. Not a problem. Do it. That's what solidarity means. And the only deputy I'm going to reference, or senator I'm going to reference, is Senator Mullins. I will not take any lectures from Senator Mullins, who campaigned against gay marriage in this country. He can keep his lectures on solidarity to himself. Hear, hear. So what about staff? What about staff? We have people saying, as an act of solidarity, let everyone into the pubs. Let's think about that for a second. As an act of solidarity, put people's lives at risk. That doesn't sound like solidarity to me. So we've got to be very careful when we talk about solidarity, because outside of here, people get what this means. Is it enforceable? Some contributors have said that it's not enforceable, but at the same time have tabled amendments to bring in things like antigen testing, which would make it much harder to enforce. Let's be clear. Is it enforceable? Are pubs and restaurants capable of asking people their age before they serve them a drink? I think they are. Are they capable of engaging with people and saying, can I see your proof of vaccination? Look, here's mine. The COVID tracker app. At the top, there's my QR code. That's it. It's no more complicated than that, right? Are pubs and restaurants, like Senator Casey has said, are they capable of keeping their staff and their patrons safe? Of course they are. Of course they are. You know, I mean, pubs, maybe not too many restaurants, but pubs in the not too distant future, they wouldn't let you in if they didn't like your shoes. They could refuse you admission based on nothing more than, look at the head in you, right? Like, are they capable even of enforcing and saying, can you show me your QR code? Thanks very much. Of course they are. Of course they're capable of doing that. And are workers being considered? Absolutely they are. And the safety of workers is being considered. And may I be very clear that the Irish Congress of Trade Unions were in the room. And the representative groups for the sector were in the room. And they don't like all of it. None of us like all of it. I don't like all of it. But the representatives groups and the Irish Congress of Trade Unions have said we have serious priorities on this. We have to watch that the protocols are fully enforced, but they are willing to go along with it. Why? Because it gets tens of thousands of men and women back to work. And that's what we're trying to do. Are we discriminating against people? No, we're not discriminating against people. We are differentiating. There's already differentiation in place, let's be very clear. For international travel, whether or not you were fully vaccinated matters. Nobody, when we brought that in, has ever suggested that that was discriminatory. People said, well, that's based on safety. It's based on what's safe and what's not safe. Under 18s aren't allowed to be served alcohol in our pubs and restaurants. Is that discriminatory? I don't think anyone here would argue it is. We say that that's the case because it's safe. You're not allowed smoke inside. Is that discriminatory? No. It's a public health measure to keep people safe. This is a public health measure to keep people safe. And unvaccinated people that I've spoken to, they get that. The only place that that doesn't seem to resonate is in the Oireachtas, right? And by the way, when I hate the phrase, but when 70s and olders were asked to cocoon on public health grounds to keep them safe, I never heard one voice say, that's discriminatory, so the entire country now has to cocoon. Because we all have to implement all the measures together. We don't, and we never have. 70s and older had to isolate themselves to keep themselves safe. Unvaccinated people need to keep out of the restaurants for a short period of time to keep themselves safe. No one suggested that younger people should cocoon as an act of solidarity for those in their 70s. People have had to do different things right from the start of this pandemic based on safety, and none of it's fair. None of it's fair. There's nothing fair about this virus. There's nothing fair about the fact that it kills older people much more than younger people. There's nothing fair about countries all over the world who can't get their hands on vaccines while we're going through 300,000 vaccines a week. There's nothing fair about this pandemic. It is brutal and it is ugly, but we're all trying to do our best. Several members of the House have asked, I think very reasonably, how bad could it get? Well, we don't know. We don't know how bad it could get. And I met this morning...
Minister, my sincere apologies to interrupt because I've asked others not to interrupt you. So can I ask you to, if you can move to finish, please?
I will.
Yeah,
I will. Thank you. How bad could it get? I met with Professor Nolan this morning and Dr. Houlihan this morning. And they were the first to admit there's a very wide range. There's an awful lot of uncertainty around this. How transmissible is the vaccine in children? We don't really know yet. What response is there going to be from Irish society? Will we have the same level of response we had last time? I hope so, but we don't know. Right? So we don't know how bad it's going to get, and they were the first to admit it. But there's things we do know. We know there were 1,000 cases yesterday. And I think there's going to be about 1,200 cases today. And we know that the numbers in hospital have doubled in the last 3 weeks. And that because of exponential growth, they will continue to double. And I know that I was talking to Philip Nolan this morning about over 200 people being in intensive care in a few months' time, and that I was beginning to talk through with the department, well, we're going to have to start building up additional surge capacity for ICU now in case it happens, So these are things that we do know. We know the range that has been given for fatalities just for 3 months is between 335 and 1,760. Now, in the War of Independence, about 2,300 people died. To put it in context of what the deaths of 1,760 people would mean. So we've got to do everything we can to push that down and down and down. Finally, and I'll finish on this, Chair, and then thank you for your indulgence. I think there's been very reasonable questions asked around, can we not use PCR testing and antigen testing? It's an absolutely reasonable question, right? And the government approach is a phased approach. The bill contains the possibility of using PCR testing, and it contains the possibility of using antigen testing. So people who are concerned about that should have no issue voting for the bill. What we're saying is, to begin with, given just how contagious this Delta variant is, given the cases are roaring, given the spike, and I want to share with colleagues as soon as I can the data I saw this morning in terms of the infection rate for the 16 to 18-year-old group. That group are now at the same infection rate as at the peak in the October wave, and the line is vertical on the page. And for the 19 to 24-year-old group, the line is vertical. We're looking at really, really, really quick infection rates for these groups. And thank God, most of them will be fine because of their age. They won't all be fine. And many of them will get long COVID. And we're really only beginning to understand that. So the situation is very serious. So we're taking a cautious approach. Might we use PCR and antigen testing in the future? Yes. And it is facilitated in the bill. But remember, a PCR test can take about 5 days to be able to detect, from the day you're infected to the day that it can detect. It can take about 5 days. There's a range, but take 5 days. So think about this. Imagine you get infected on a Wednesday. And in good faith, you go and you get yourself tested on a Friday. And you get a negative PCR test. You may well be contagious very shortly. And now you go out to restaurants and restaurants and bars on the Friday night, or the Saturday night, or the Sunday night, with this super contagious variant. So we're taking an approach that says we may well use PCR and antigen testing, but not yet. We're watching what's happening in Scotland, watching what's happening in England, Wales, Northern Ireland, the Netherlands, Spain, Portugal, Cyprus. And we're saying we're going to be cautious about this. And we're going to do it in a way that is safe. We're going to do it in the safest way possible. And therefore, that is why the bill is structured as it is. It is possible under regulation to bring testing in. And finally, and I'll finish on this, and thank you again, Chair, I don't want this legislation. None of us want this legislation. And my hope is that long before the 3-month period at which this legislation automatically falls, we won't need it. Because we'll have reached a level of vaccination, and people will have continued to follow the public health measures to such an extent that the risk profile falls and we can all get back to living normal lives. Gurmagad.
Gurmagad, Ara.